60 out of these had hypocalcemia, but bone biopsy was the criteria used were quite stringent. I might say in this study they were using very stringent criteria of reporting osteomalacia. So coming to the theme of fractures and prevention of osteoporosis, a meta-analysis of 7 randomized controlled trials reported in 2006 showed that 400 international units gives no benefit. If you want to prevent fractures, you have to give 800 international units at least. And there is, in these meta-analysis, hip fracture reduction was reduced by 26%. Another study in the prevention of fractures in nursing home patients was by Chapoy et al. From France, published in 92 way back, and they reported reduction of hip fractures and vertebral fractures by using again 800 international units of vitamin D along with 1200 milligrams of calcium. Now the very well-known study, the WHI study, in which estrogens were afterwards removed as the first-line therapy. There, in that subgroup analysis, they showed that those patients who had vitamin D levels below 26 nanograms had no benefit on the risk of fractures. The benefit of estrogens, that is on the hip fractures, only occurred when their vitamin D levels were above 30 nanograms. There are other benefits of vitamin D, that is on the muscle strength, because the muscles have receptors for vitamin D and they have waddling gait and they have difficulty walking. And so another meta-analysis on the risk of falls in the elderly showed a 22% reduction by achieving good levels of vitamin D. And another study of nursing home residents for 5 months of 800 international units of vitamin D with calcium showed a 72% reduction of risk of falls in the very elderly in the nursing homes. So there is benefit. Apart from osteoporosis, the risk of fall reduction is also there with vitamin D. Now, there's a lot of interest in the other benefits of vitamin D, and one of them happens to be cancer. Now, there are epidemiological studies coming from the Scandinavian countries which have reported that those with low levels of vitamin D in the population have a 30 to 50% increased risk of colon, prostate, and breast cancer, even controlling for other variables. And there are several of these which I have referred to here. And you might ask me, how does it work? Now, the cells, that all these cells, the prostate cell, the colonic cells, the breast tissue, there is local expression of 125 hydroxylase enzyme. That local production of converts locally vitamin D into 125 active local metabolite. Now that local active metabolite has effects on the gene regulation, in which angiogenesis, apoptosis, cell proliferation, there is not enough time to share the data with you, that they're all regulated. So absence of vitamin D leads to perhaps more angiogenesis, more cell proliferation, lack of apoptosis. This is the theory. This is an evolving story, and a lot more will come in this. And then once the cell has, let us say, utilized the active 125, it then produces the metabolic enzyme D, which converts it into 24-25 form, the inactive form. Now, there was mentioned by Dr. Humera Badshah on the knee OA and vitamin D, and this is the Framingham cohort in which they looked at the risk of progression of osteoarthritis with vitamin D. And there they showed that of 556 patients, there was a 3-fold increased risk in the middle and lower tertile. So they divided the vitamin D levels into 3 groups. Those in the higher 1/3 group of vitamin D levels did not progress, they did not have progression of OA, whereas those in the middle and the lower 1/3 had progression of osteoarthritis. So there is benefit in patients even with osteoarthritis to keep an eye on their vitamin D levels and ensuring they remain above 30 nanograms. There is a lot of evidence in published literature on risk of other diseases like type 1 diabetes in children, multiple sclerosis, and even rheumatoid arthritis. One reference I could dig up from Arthritis and Rheumatism in the year 2004. And similarly, cardiovascular benefits. The evidence is not so robust, but there is one very interesting trial which was then published in a prestigious journal like Lancet, in which hypertensive patients both had systolic and diastolic hypertension. They were given ultraviolet B radiation 3 times per week for 3 months. And there was a 6 millimeters reduction of blood pressure, both systolic and diastolic, and they claimed their blood pressure had normalized. And there is another report of association of vitamin D deficiency with congestive heart failure, just one single report I could dig up. So coming to that, what is the message? How do you measure vitamin D in our setup in our country? The only reliable method is the enhanced chemiluminescence technique, which means the Roche analyzer, which is available in Aga Khan, which is now commercially available in a lot of other labs in a lot of other cities like Shaukat Khanam, I think in our center in the Fauji Foundation, and I'm sure Excel Lab in Islamabad has got one machine. So it is now easily available. The unfortunate thing is that since the physicians are ordering vitamin D test, there is a cheaper kit of ELISA which is being employed by several labs. At least I know in my city some of the labs are using, and that is not a good technique. And they are good enough. They do say that we have estimated vitamin D through the ELISA technique. That's not to be relied upon. It has to be the chemiluminescence technique, which right now means just one analyzer. So what is the take-home messages? That all children and infants should receive at least 400 international units. Previously it used to be 200. Pregnant and lactating mothers should be on at least 800 international units per day with elemental calcium of at least 500 milligrams. For postmenopausal women, it should be minimum of 800 units. You can go up to as high as you want, provided you keep an eye on them. And also in the subgroup of chronic kidney disease, it's not enough to just give them calcitriol orally. You must monitor their serum levels and aim to maintain them above 30 nanograms. Thank you very much.
Should we have time for the question?